Does every mosquito bite result in malaria? Are mosquitoes the only carriers of this disease? These questions bring us into the fascinating yet often misunderstood world of mosquitoes and malaria. Today, we will debunk 10 common fallacies about this subject. Fallacy number 1. All mosquitoes transmit malaria. False. Of the 3,000 species of mosquitoes worldwide, only a handful, belonging to the Anopheles genus, can transmit malaria. So, the majority of mosquitoes are not spreading this disease. Fallacy number 2. Mosquitoes transmit malaria to each other. Again, incorrect. Mosquitoes become carriers of malaria when they bite an infected human. They do not pass the disease amongst themselves. The third fallacy, malaria is only a tropical disease. Wrong once more. While malaria is more prevalent in tropical and subtropical areas, it can and does occur in other climates as well, especially where conditions are conducive for mosquito breeding. Fallacy number 4. All mosquito bites lead to malaria. Not true. Only bites from female Anopheles mosquitoes that carry the parasite can cause malaria. Most mosquito bites are harmless, apart from the itch. Fallacy number 5. Malaria is always fatal. Incorrect. While malaria can be deadly, it is treatable if diagnosed early. The lethality of malaria largely depends on the type of parasite involved and the patient's access to prompt and effective treatment. Fallacy number 6. Indoor spraying and insecticide-treated nets have eliminated the risk of malaria. False. While these methods have significantly reduced the incidence of malaria, they have not eradicated it. Mosquitoes can adapt and become resistant to insecticides, and some mosquitoes bite outside the protection of nets and sprays. Fallacy number 7. There's a vaccine that can prevent malaria. Partially true. While there is a malaria vaccine, it is not 100% effective. The best protection against malaria still involves preventing mosquito bites and taking anti-malarial drugs. Fallacy number 8. Only poor countries suffer from malaria. Incorrect. Malaria is not limited to low-income countries. It is prevalent in over 90 countries worldwide, affecting both rich and poor nations. Fallacy number 9. Mosquitoes bite at night so there is no risk during the day. False. While most malaria-transmitting mosquitoes bite between dusk and dawn, some species are active and can bite during the day as well. Finally, fallacy number 10. Mosquitoes are the only carriers of malaria. Not true. Malaria can also be transmitted through blood transfusions, organ transplants, or the shared use of needles or syringes contaminated with blood. So there we have it. 10 misconceptions about mosquitoes and malaria debunked. Having accurate information is crucial in the fight against this disease. It helps in guiding prevention efforts, improving treatment strategies, and informing public health policies. Remember, not all mosquitoes are malaria carriers, and not all mosquito bites lead to malaria. Malaria is not confined to the tropics, nor is it exclusive to poor countries. While prevention methods have reduced the incidence of malaria, the disease has not been eradicated. And finally, mosquitoes are not the only means of transmitting malaria. Stay informed, stay safe.